I'm Frank Ski of V103 and the Frank Ski Foundation. It is my pleasure to serve as your MC this morning as we host our Fulton-DeKalb Hospital Authority's 6th Annual Health Summit. This morning, we have a number of issues we will deal with, but right now, I have the honor of introducing Fulton-DeKalb Hospital Authority Chairman of the Board of Trustees, Mr. Tommy Dortch. For many, he needs no introduction, but for those of you who may not know, Mr. Dortch is a living legacy in our Atlanta community. There are many people, even leaders, who have great oratory. They inspire and they are needed. Mr. Dortch, on the other hand, is one of those rare individuals who not only talks the talk, but he walks the walk. Help me to welcome to the stage Mr. Thomas Dortch.
Good morning. While we're waiting for everyone to work through this great Atlanta traffic, we have over 1,000 people who registered for this conference today. This is our 6th year. And 6 years ago, we didn't know if people would turn out as we tried to ensure that we had communication and dialogue about health challenges in this area. The Fulton-DeKalb Hospital Authority was created 75 years ago by an act of the Georgia General Assembly with the charge of ensuring that in Fulton and in DeKalb County, we worked to make sure that there were healthy communities. And while we own the Grady Memorial Hospital system, and while we worked and now we have 125 years of great years of Grady, it is one of the most phenomenal institutions you will find anywhere in this country. We are the largest safety net hospital in the southeastern region. We're the 5th largest safety net hospital in the United States. And Grady is not just a hospital that sits around and just to survive. With our stroke center, we have one of the best stroke centers in the nation. With our HIV clinic, we're helping to ensure that the spread of HIV and AIDS is stemmed in this city. Because if we get citizens and people who know their status and they come to us, we can ensure that with our medical support and with the cocktails that we provide free of charge at this center, they can't infect anyone else. And while there's not a cure, we can stem the infection rate. And by the way, over a year ago, Atlanta was rated the #1 city in the nation for new infections for HIV and AIDS. And so my colleagues from the Fulton-DeKalb Hospital Authority and with all of our colleagues at the Grady Health System and the 35+ community-based organizations that we fund and support, we're trying to ensure that this community will be healthy, ensure that in this community, if you have a health need, we will provide for it, no matter what Congress attempts to do and the President and those attempt to do with the Affordable Care Act. Grady has always been there, and Grady will continue to be there for this community and for the people that we serve. And so we want to thank all of you for your support. We want to thank the Fulton and DeKalb County Commissions for their years of investment in the Fulton and the Grady Health System. So I'm going to get out of your way. We have a robust program for you today. Today we want you to spend time. We want to make sure that you learn all that you can, that you go back to your communities and you share, because it's communities and people who will make the difference. We have the best doctors, but we don't want to see our citizens in Grady. We want to make sure that they stay healthy, but if they need a hospital, if they need a health system, if they need our clinics, we will be there for them. So I'll introduce my colleagues later as the program goes, but on behalf of the Fulton-DeKalb Hospital Authority and our phenomenal staff, we want to thank you. And of course, get engaged, get involved, and before you leave, right down the hallway, we have a health screening room, and we want you to come and get your exams, get tested, because if you know what your challenges are, we can guarantee the doctors will take care of you. Thanks for coming out this morning.
So let's present the candidates.
So we're going to start. We're doing this in alphabetical order. Please welcome Peter Amon, John Eves, Vincent Fort, Wanza Hall,
Keisha Lance Bottoms, Caesar Mitchell, Mary Norwood, Michael Sterling, and Kathy Woolard.
So, Alexis, as the candidates are coming up, if you don't mind, let me just make a couple quick remarks about how we've discussed we want this to unfold today. Clearly, we have a stage full of candidates, and everybody is here because this race has generated such enormous interest, and we do want to give them all a chance to answer the questions that have been put together by the Fulton-DeKalb Hospital Authority on the basis of things that matter to them. We're going to have to sort of play traffic cop. We would love to give each of them as much time as, well, maybe not as much time as they want, but we're going to have to keep things moving. So I've agreed that when a minute is up, I'm going to sort of play the bad guy. I'll try to signal you to move on to the next person, but please forgive me if I sometimes seem to be rude. I don't mean to be. I just want to make sure you all get a chance to comment on the questions.
All right. So we're going to start again. I said no opening statements, but you'll have a minute to respond to each question. And I'm going to sort of start off with an easy softball and just ask, have any of you ever been treated at Grady Memorial Hospital? And you can just say yes or no, and if you want to expound, you have a minute to do that. And we'll just start with Peter.
No.
No, but my children have been to Hughes Spalding.
Okay.
Yes, I have.
Yes, I was born at Hughes Spalding, Pavilion and Grady, and my very first memory in life was recovering from surgery as a 3-year-old at Grady Hospital.
I volunteered at Grady as a member of the junior league. Does that count?
I have not been treated at Grady, no.
Not yet.
Okay. Do you want to begin, or shall I?
No, go ahead.
All right. So the theme, as you have maybe heard, is about HIV and its treatment and its impact on the community. And I'm just wondering, how do you all think you are going to improve the rates of infection and treatment here in your role as mayor? And this time we'll start with Kathy Willard.
Thank you for asking. You know, we have one of the highest rates of HIV infection in the world here in Atlanta, Georgia, particularly in 30310, 30311, particularly among young black men who have sex with men. It's a tragedy what's going on. I'm sure people in the audience are familiar, and we're grateful for the work that Grady does. Where Atlanta can be most helpful is within our core business, and one of those things is within housing, because people who aren't housed are unlikely to stay focused on the treatment regimen that they need to keep to stay healthy. So making sure that we're expanding the options for housing and making sure that people have housing near transit so that they can get to care is one of the most important things we can do. But also as mayor, being somebody who's well-versed, who understands what's going on in the community, and who can speak to the community from a place of knowledge about what they need to do to take care and represent a healthy lifestyle to others is important.
I think one of the biggest ways we can have an impact is working in coordination with the CDC, with Grady, with our Fulton County partners. We have to have a singular focus on prevention. And so we've got to do things like make access to the PrEP drug more readily available to citizens all over our city. We've got to do a better job with education. You know, what was disappointing was a few years ago, Fulton County lost nearly an $8 million grant simply because of bad management in terms of helping prevent and treat HIV/AIDS. We've got to make sure that we don't lose money while we suffer from this epidemic, because we are literally, losing people when we lose that type of resource. So we've got to make sure we're going after federal grants. We've got to make sure that we're focused on housing opportunities for people with AIDS. And so we've got to make sure that we're focused on prevention. We're focused on providing more access. We're working with the CDC, and we're working with a singular focus and coordinating across multiple different jurisdictions and multiple different health partners and focused on prevention.
I think one of the most important things that the mayor can do is to work toward the decriminalization of HIV/AIDS. The law now says that if you have sex and you are, quote, infected, that it is a felony if you do not tell that partner. What California has done is to have their law separate, where you have either the intent that it's an intent law where you intend to infect someone, because we know if you have Truvada, the PrEP, that you will not, now the studies have said that it is impossible for you to actually infect a partner. So we need to be very thoughtful, because we are having people scared of having a felony charge, and I believe that law needs to be changed.
You know, I live in historic West End. I'm raising my family in historic West End. That's 30310, one of the places where we have the highest incidence of HIV. As mayor, I'm going to speak up. I'm going to make sure that we're all working together and talking about the issue. I remember several years ago in my community, I hosted a testing event at a health club. And I was really encouraged and surprised at how many people stepped up and got tested. So when I'm mayor, I'm going to encourage folks to get tested, number one. Number two, I'm going to encourage the entire community to act as partners. We're going to engage nonprofit organizations. We're going to engage our school system to make sure that young people are getting educated about HIV very early on in their life. We're going to make sure that the city of Atlanta stands with Fulton County, stands with the hospital authority to ensure that everyone understands how serious this issue is, and that we're all working together, not only to prevent it, but certainly to eradicate it.
Before you, as you go on, and I'll give people who have already spoken a chance, if I could add to this, Mary Norwood's proposal, I want to, in addition to answering the question that Alexis asked, is Mary Norwood's proposal to decriminalize this passage of HIV from one to another the right approach? As you answer the rest of the question, I'd really love to hear if you're in accord with...
It's not the passage, Mr. Nygaard. It is the idea that if you're taking the drug, you cannot infect someone. If there is nothing, if you are no longer able to infect someone else. And what's happening now is people are not getting tested because they don't want to, quote, know, because if they know and they then have sex, then they are committing a felony if they haven't told that other partner.
Okay.
So it's a different.
I apologize.
No.
Thank you for clarifying.
Okay,
But
thank you,
let's
sir.
go ahead, Kwanzaa.
Thank you for having me. First, I'll say there's a coordination component of this for sure across jurisdictions. There are a lot of silos, and people really are not working in as collaborative a fashion as possible, whether it be around housing or transportation, or just sharing resources and making sure we're aligning. Once we align well, we can leverage more, and I think that's definitely one component. But in Atlanta, we have something that's very, very special in light of the challenge that we're faced with as young people who are in the neighborhood I grew up in, 30311, 30310, who are infected across gender. So it's not even about just homosexual, it's about all young people. We need to use the music industry and the entertainment industry. I'm going to reach out to all of my friends in that category and have them to use their megaphones to really spread the message and to prevent young people from getting caught up in this space. This is the only way, because they have more influence than anyone in this room. Thank you.
Well, nobody can speak to health on this panel as good as I can. Going back to your first question, Alexis, not only was I served at Grady Hospital, I saved Grady Hospital in 2008 and 2009. In terms of HIV and AIDS, we are doing some progressive things right now in terms of coordination. First point, Michael Sterling mentioned about money being lost. Most of that money was recouped. Only a small proportion went back to the CDC. Number two, under my watch as chairman of Fulton County, we created PrEP clinics, which provided the Truvada drug to folks who are infected and minimize the likelihood of transmission from one infected partner to another. Not only did we do PrEP clinics, but I also got a $100,000 grant from Kaiser Permanente to do the first PrEP clinic at a college in the United States. It was at Morehouse College last February. Number three, we were, as a county government under my leadership, we supported syringe exchanges. And then lastly, very bold and very progressive, we are promoting sex education be done in the school system, not abstinence-based education, but also in terms of safe practices.
Good morning. I'm Keisha Lance Bottoms, and thank you for having me this morning. We really can look at San Francisco and look at the model that they created. San Francisco was ground zero for the HIV epidemic in the 1990s. And if you look at the statistics today, there are less than around 200 cases a year people diagnose, and it really is because San Francisco has given people an opportunity to focus on their health. And that's what we are faced with, a challenge here in Atlanta. Although there's a huge gap between demographics in terms of wealth and access to health care in San Francisco than here, as a city, it really is our responsibility to coordinate with all of our partners. That's why I have committed to appointing a director of public health, not just to deal with HIV, but many of the other issues, health issues that impact our community in a very different way than many others, including high blood pressure, cancer, diabetes, et cetera. And it really is about a coordination of efforts and allowing us to let people focus on getting well.
Good morning. Again, my name is Peter Amon. Thank you so much for coming out here this morning. I know it's a bit on the early side, so thank you for coming. Thank you for listening. You all are deeply involved in these issues, I know, and we appreciate the opportunity to speak to you on them. A number of my colleagues have mentioned several ideas which are good. I would underscore the importance of housing and supportive housing for the homeless. I would underscore the importance of PrEP and access to PrEP. I would underscore needle exchange and access to needles. All of these things are important tactics. Above all else, though, as mayor, I am going to reach out and use the mayor of office as not a bully pulpit. I don't really like the term bully pulpit. I like to think of it as a pulpit of hope. We need a pulpit of hope. We need a mayor who will talk about the things that aren't always being talked about. And so in this instance, it's education, it's marketing of the issues that we are facing and how we deal with them collectively as a community.
Thank you all for not only answering Alexis's question, but I really appreciate the fact that you are doing your best and you're staying within our time restrictions. I really appreciate that a great deal. I want to move on, and I'm going to start in the middle. And I'll start with you, Kwanzaa, if I may. We know that Congress has passed a crucial deadline for refunding some community health programs that are really essential to communities around the United States, and certainly crucial here in Atlanta and Georgia. One of them is the CHIPS program. We are aware of the fact, which here we call, of course, Peach Care. We're told by the State Department of Health that there is money that will continue that program for the time being, but at a certain point we're going to lose it. But of more immediate concern, I think, to Grady Hospital is that disproportionate care payments to hospitals that deal with a great number of indigent patients who get funding from the feds to be able to handle that volume. I don't know. I wonder if there's anybody in the room. I used to have this number, know exactly how much Grady gets in those disproportionate care treatment payments. It's a lot. So, Kwanzaa, let me start with you. How do you address, if these payments are not going to be coming in, how do you address Grady's ability, how would you suggest it be addressed, to continue dealing with the indigent patients that it has to? And what are your thoughts on the fact that you have a Congress and a White House that seems to be a little unwilling to help in these areas?
Well, first I'll say, you know, in any situation, and for me as councilman for the heart of the city, there are more homeless and indigent individuals than all the council districts combined. So I tend to feel the brunt of that in a general way for all the time I've been elected. It's all about relationships, no matter what you're talking about when you're going across jurisdictions. So you wouldn't, as mayor, I would want to work directly with our Republican leadership to figure a strategy on how we make it a win-win to pull those dollars down and try to have Atlanta to be repositioned or Georgia to be repositioned. Maybe some other brand name they want to put on it. A lot of times with politicians and you're trying to get things done, egos are in there. So if there's a fight against one name, you have to reposition the name and figure out how to get the resources to still come your way. So it's really a lobby effort, and it's about the pork and the usual conversations that you have direct and interjurisdictional.
Thank you. Kathy, let me turn to you on that because I think that's an important point. What do you imagine your power as mayor would be to be a voice in Washington in an environment in which this is primarily a Democratic city? There isn't a great a Republican force here that can go and advocate on behalf of the city. How do you cope with a problem like that if you're mayor?
Well, thanks, Bill, for that question. I've been actually lobbying in Washington and at the state level on exactly these issues, HIV, LGBT issues, health disparity, Medicaid expansion for quite some time. And so I would just continue that work as mayor to make sure that people understand the human toll that is taken when we do this. You know, in Atlanta, Georgia, where we have some of the highest levels of income inequality, and we have income and racial disparities in terms of health, it's absolutely front line. And I want to say, let's not forget about the role of the state, because our state's failure to expand Medicaid has been an absolute tragedy. I was interim executive director at Atlanta for a year as we tried to accommodate the ACA and get more people involved in insurance so that we could get more reimbursements. And now, as fast as groups have tried to make that accommodation, we now see this administration dismantling it. It is a tragedy and a train wreck what's going on, and I'd be very, very aggressive.
Mary, I think that's a really important point. I think you know the Republican legislature here, for the first time really since Obamacare, has begun to express more interest in expanding Medicaid. Are you in favor of the expansion of Medicaid? And as mayor, would you be down there at the Capitol lobbying in favor of it?
Absolutely. And as the independent in this race, I believe that I will be able to reach out to both sides of the aisle very effectively, both at the state level and at the national level. It is critically important that Atlanta come to the table as the city that serves everyone, as the city that is compassionate and caring for everyone, and that we make that point very clearly. So yes, absolutely.
Who wants to grab it next? John?
So, Bill, it's about leadership. The mayor has been absent in this conversation, has been virtually absent. The mayor has a seat at the table. The mayor can have a voice. Number one,
I'm sorry. No. Are you suggesting that the mayor's relationship with Governor Deal, which is pointed to as an example of really wonderful cross-party cooperation?
It's limited. It's not in the healthcare. It is not in the healthcare arena. I want us to be clear on this. Under my watch as chairman of Fulton County, I reconfigured the health department. On the health department board, you have a seat for the chairman of the Fulton County board and the mayor of Atlanta. The mayor is at the table to be collaborating with the county. Has not said very little about Medicaid expansion. I used my role as chairman of Fulton County, lobbied Congress, the local delegation, as well as going to Capitol Hill for Medicaid expansion. I was involved in the enrollment of Obamacare. And then related to this question, we must respect the role of the counties. Fulton and DeKalb County support Grady Hospital. The monies that are raised and generated support indigents. We must respect and collaborate and support the role of county government. And fourthly, there are health clinics around the counties. We should maximize their utility in terms of delivering health care for our citizens.
I gave you a few extra seconds because I interrupted you, but thank you for clarifying. Who else wants to give? Peter?
So the first thing I'd like to mention is we have as much great work as Grady has done. We have significant differences in lifespan in the city of Atlanta. We have 2 adjacent zip codes where your average lifespan in the northern one is 12 years longer than your lifespan on average in the one just to the south. These are adjacent zip codes. And this data has been known for some time, 12 years. That's an enormous statistical difference. And so Grady's role is so essential to keeping us where we are now, but improving. So the first thing I would say is we have to support Grady under all circumstances. So yes, I would support and lobby for the expansion of Medicare in Georgia. I would absolutely do everything I could to work across the aisle at the state and federal level to make sure that these payments are continuing. And if we can't continue these payments, we need to recognize as a community, counties and cities together, and it's more than just Fulton and DeKalb, we need to add other counties, that we have to find a way to support Grady Hospital.
I'd like to say, I think so much of the bill has to do with prevention in many communities. My father died at 55 of heart disease. Both his parents lived to be almost 90, so genetically he should have lived longer. But because of lifestyle, because he smoked, he died at 55. And so I think from a city perspective, what our biggest opportunity is to work within our respective communities to make sure that there are resources for preventive measures as it relates to any number of our health problems. And as we talk about our centers, our community centers, and talk about wraparound services, that's also a component. It's not just about job training and education, it's also providing services and resources so that we can help people be well enough to get jobs and to stabilize communities. And I think that's a huge opportunity that we have from the city perspective, and one that, quite frankly, we haven't done the best at filling.
One follow-up, if you don't mind. Do you think the city of Atlanta, am I correct in characterizing us as being at something of a disadvantage? Because for the most part, this is a Democratic city having to deal with a Republican administration, our own congressional delegation, as well as the White House and Congress in Washington.
Well, you know, you've heard it said many times that there is Atlanta and then there is the rest of Georgia. So it's a challenge, but it's certainly something that it is what it is, and we have to take the opportunity to fill in where we can and do what we can from our perspective. The great part with the city of Atlanta now being financially stable, we have resources and opportunities to focus on our communities, quite frankly, that we didn't have many years ago.
We're not at a disadvantage. We're not at a disadvantage. There are red states that have Medicaid expansion. The city, the mayor has not made a priority. That's the reason why there has not been a result.
Thank you. I know you want to get in, Michael.
Yeah, Bill,
And then I think you do, Caesar, too.
Well, we'll certainly never be at a disadvantage when I'm mayor. But what I would like to say is that when it comes to city leadership, you know, one of the things that I think we've got to focus on is behavioral economics. Jim Clifton writes in his book, The Coming Jobs War, that we spend about $2.5 trillion nationally on healthcare per year. That's expected to increase about 6% year after year. So we're looking at about a $10 trillion healthcare cost for the country over the next 10 years, and we've got to focus more. And the CDC says about 75% of the $2.5 trillion we spend per year come from preventable diseases. And so when you talk about city problems and city solutions, one of the reasons that we've been able to decrease smoking in half is because cities have led. Cities ban smoking in restaurants and in certain public places. So there's been an opportunity for the city to lead, and we've got to lead when it comes to prevention. We've got to do a better job of encouraging people to live healthier lifestyles and impacting where we can the behavioral economics of our constituent base, and lead on making sure our constituents are living healthier lifestyles and preventing these costs from continuing to increase.
Thank you. Caesar, I want to make sure I say the question again. It's about what Atlanta can do to assure federal funding that appears to be drying up.
I'll be really brief about this. It's about relationships, and it's about the willingness of the mayor to set the tone and leverage the power of relationships. I'm the only candidate up here that sits on the board of the ARC, and I don't just warm a seat there. I'm the only candidate that sits on the board of both the ARC, the Georgia Municipal Association, and really works hard to make sure that these organizations, which really comprise of Democrats, Republicans, and also independents, gets the work done at the state level and at the federal level. I work side by side every day in my law practice with former Senator Saxby Chambliss. I'm probably the only candidate up here that's been invited to the State of the Union by Johnny Isakson. That is because of relationships. When I'm mayor, I'm going to leverage every relationship that I have to ensure that we're getting our fair share of Medicaid here in the state of Georgia. The city of Atlanta is the capital city of the state and of the South. And when the mayor steps up and works with all of his partners around the state, we can make a true difference in terms of getting money not only from the federal government, but also from the state.
Okay, everybody's had a chance on this, right? Okay, Alexis.
Okay. It has been said that if you have a stroke, if you get shot, if you get stabbed, you want to go to Grady because that has the trauma center and the expertise to take care of you. But as mayor, what is it that you think you can do to cut down on some of the gun violence that perplexes the city? And let's start with Mr. Mitchell, and then we'll go to the right and then come back to Peter.
Well, you know, my father was an Atlanta police officer, and he believed in community policing. He walked a footbeat. When I'm mayor, I'm going to make sure our police officers are on the street, in the community, working with young people, protecting our seniors, and making sure that they know on a very granular level where the guns are. Because when you know where the guns are, you can go get them, number one. Number two, as mayor, I'm going to make sure we're partnering with nonprofit organizations, partnering with Fulton-DeKalb, the Hospital Authority, to ensure that we're buying back as many guns as we can and getting them off the street. Thirdly, I'm going to advocate at the national level for what I would call stronger gun technology, so that if you are stealing a gun, you can't use that gun because the technology of that gun won't allow you to do that. That's the future, and that's the work that we've got to do if we really want to be serious about getting guns off the street, disincentivizing the theft of guns that are proliferating in our community.
There are several things that we need to do. Number one, when we have 2/3 of the city that is seeing no redevelopment, no job opportunities for our young people, we have a desert. We have not only a food desert in parts of our city, we have a health desert, because when we closed down the Southwest Hospital, it is so hard for citizens in that part of the city to get, whether to Grady or any of our other hospitals. So one of the things regarding guns is we need to have jobs for our young people. Right now, they see no future other than joining a gang and getting things illegally. And the second thing that we need to focus on is the adults who truly, I call it violence trafficking. When a 22-year-old gives a 14-year-old a gun because nothing will happen to the 14-year-old, we are literally inadvertently literally enabling young people to have a life of crime and lose their lives forever. So what do we need to do? We need jobs for the young people. We need the wraparound services like the At Promise Center. And we need, okay, I'm now, there's more. There's more. Thank you.
You were starting to sound like the disclaimer at the end of a pharmaceutical commercial. Trying to get it all in. Thanks.
No, Alexis, I've been on multiple sides of this issue. As a former federal prosecutor, I actually worked cases with the ATF in terms of seizing illegal guns, and I think we've got to do a better job at the city level in terms of partnering with our federal partners and doing deep investigations to make sure we're taking illegal guns off our street. I've also been robbed at gunpoint with an AK-47, surrounded by multiple guns, right in downtown Atlanta on Peter Street, where I was forced to be face down and robbed at gunpoint. And so I know, what gun victims go through, and just the idea that your life is flashing before your eyes. And so the issue is very personal to me. And I do think we've got to invest more in jobs. I'm happy to hear some of the council members that I'm running against talk about that, because you know how much the city of Atlanta has invested in the Workforce Development Agency. $0. The city of Atlanta has not invested any money in the Workforce Development Agency. We've been completely reliant on state and federal grants. And so when I'm mayor, the city will invest money in summer employment to help more youth have those opportunities we all know that they deserve.
Thanks for asking that question, Alexis. I think it's really an important one. We don't talk about it enough. Again, in my career as an advocate and within my own company, I've represented Bloomberg's Everytown USA organization for a number of sessions down at the Capitol. So I've worked against the expansion of stand your ground laws here and in Florida. I've worked against the Guns Everywhere bill and then the subsequent campus carry effort. We have a General Assembly that won't be happy until every single person can carry a gun openly anywhere, anytime they want to do it. And that doesn't make any of us feel any more safe at all. I agree with everyone in what's been said. We need to have more availability regularly for people to dispose of guns that they found, that they don't want in their house anymore. Not just sort of every couple of years it pops up, but regular opportunities for people to get rid of guns. And also I agree about the issue of youth job programs. We used to have a great youth job summer program. We don't really have it anymore, and I think giving kids the opportunity to get money and learn how to join the workforce is probably one of the strongest things we can do.
Thank you. Now, I did say we would go to Peter, but I want to change that and start with Kwanzaa and go down. So we mix it up a little bit.
Oh, thank you. Thanks. Well, I sat here and I thought about growing up in Southwest Atlanta and having access to guns as a child. 14, 15 years old, we had access, and that was 30 years ago. So think about what kids have access to right now. A whole lot more stuff. I represent the area with the greatest concentration of poverty in the Southeast United States, the Boulevard Corridor. Average income is $3,000 a year. Average rent is $12 a month. There are a lot of guns that were there when I came into office as a council member, but we worked to strengthen the families and children, to give them a way to own their own future with job opportunities, with job training, as well as access to support for their children. Because a lot of the young parents are 22, 23-year-olds who have access to guns. And the young kids have access to guns as well. So I think it's really about strengthening our communities from the inside out. People might not give their guns away because they don't feel safe in the community they live in. So that's part of the solution, is making our community strong from the inside out. Thank you.
So I think they have it completely wrong. You declare gun violence as a public health issue. You look at communities like a healthy community or a community that has diseases. You look at it from a public health perspective. Look at how trauma has an impact on young people and how it causes them to have a propensity towards violent behavior. You unleash mental health services. You provide wraparound services. You support the family. You create jobs. You have the communities or neighborhoods are a living organism. Some of them are diseased with cancer. Some of them are vibrant with people who are healthy. We look at it from a public health perspective, and you treat it from a public health perspective. That's the only way you can address and resolve the gun crisis in our neighborhoods of the city of Atlanta.
Thank you. I have practiced law for over 20 years, and during that time I've served as a criminal defense attorney, a prosecutor, and a judge for 6 years. And what I know is that you can't legislate your way out of bad behavior. You have to get to the root of what the issue is. The thing that always struck me when I was a judge, when men would come in to fill out applications for public defenders, the vast majority of them had not finished 9th grade. That means that the problem doesn't start when they're 18 and 19 standing before a judge. The problem starts when they're in 3rd grade and they can't read. So as we talk about gun violence is at the other end of the spectrum. What we're really talking about is what are the opportunities, the educational opportunities for young people in our community. It really has to be about a proactive approach. We can't wait until they're 18 and they are facing murder charges. My nephew was killed 3 years ago, and what struck me is that the young men who killed him are young men who should have been his friends. They looked like him. So something has gone wrong along the pipeline, and I think that's where we need to fill the void in this city.
Thank you. As Chief Operating Officer for the city in 2010 and 11, I had the honor and privilege of supervising the police department and working closely with Chief George Turner. And I would go to a homicide scene every few weeks, and I would spend several hours. And I would get an opportunity to see every few weeks the devastating impact of gun violence on individuals, on families, on the community. We certainly have to partner with other organizations to get guns off the street. We absolutely have to do everything we can there. But ultimately, we are not going to police our way out of this gun violence challenge. What we need to do is put in place the full set of services that we need for people. We need early childhood learning, birth to age 3. We need a collaboration and a collaborative relationship with the Atlanta public school system. We need about 10 times more job training and job placement throughout the city so people can get jobs. And we need to do all of this in a very rapid fashion.
Thank you. I want to, if you don't mind, expand on that just briefly. Is there anyone of you on the stage? We know that it is unlikely that a Republican-controlled Congress is going to take much action in terms of restricting access to guns. Maybe they're going to pass, or they're going to allow for alcohol, tobacco, and firearms to put a regulation in place on bump stocks. Is there anyone on the stage who does not believe that Congress should be looking at further restrictions on gun control, whether it's access for people who have mental health issues? Should there be more attention given to waiting periods? Is there anybody who thinks the laws right now are exactly where they need to be? And if you aren't going to raise your hand on that, does that mean you all believe there should be some further action? Yes?
Yes.
Everybody?
Yes. Yes.
Further action.
Yes.
Okay. Thank you. I appreciate that. And by the way, again, thank you all. You're really being great in trying to keep to these time limits. So I want to move into a completely different area now, because the authority actually asked all of the registrants to this conference what was the first number one question they would like you to answer. And I'm going to basically read to some extent what they said. The number one question they wanted us to ask you is, what are your plans to work with local school systems to address literacy, dropout rates, and other factors that do contribute to poor health? Anybody want to grab that? Michael, I saw your hand first, and then Mary, I saw you. All of you will get a chance.
Well, thank you so much for that question. I think that's probably one of the most important questions. You cannot be a great city without a great public education system. And so I've often said, my grandfather used to tell me that when the elephants fight, it's the grass that suffers. And that's what we've seen a lot in our politics. We've seen a lot of infighting between City Hall and Atlanta Public School System. And when I'm mayor, I'm going to be the partner in chief with APS. What I've heard from teachers and from school board members and from administrators all over the city of Atlanta is that we have a hierarchy of needs issue when it comes to our kids. There's so many social challenges that our kids are facing that the city can partner with APS to address issues that are happening outside of the classroom that are impacting teachers' ability and students' ability to perform inside of the classroom. What we can do is partner with APS to find out what those critical issues are, what those social challenges are. And then we can help to solve and address some of those challenges by extending the hours of our Centers of Hope, providing mental health services, tutorials. So really being a partner in chief with the Atlanta Public School System. We serve the same families and neighborhoods and communities, and we ought not be fighting one another, but we ought to be working together to provide educational opportunity for all of our kids.
Real quick, and then everybody else want to answer this too. Michael, what do you say right now is the relationship between the current mayor of Atlanta and APS? What would you be inheriting in terms of that issue? Real quick, like 10-second
No, I mean, I think obviously the relationship is strained. There's been a lot of back and forth between deeds and the Atlanta Beltline issue that APS had. So I think the relationship is certainly strained.
Okay, Mary, I saw your hand next.
Yes, two things. Number one, I have met with the superintendent. We have discussed the goals that she has, and I have agreed with all of those goals and how the city can be helpful. Secondly, what has been really wonderful is that we now have the attention of the entire corporate and philanthropic community. We have 4 organizations who've gotten together to partner in a program that is called Learn for Life. And it's the United Way, it's the Regional Commission, it is the Community Foundation, and it is the ARC, United Way, Regional Commission, and fourth one. Do it in a minute. Those 4 organizations have come together, and they are sponsoring all the superintendents of the 5 core counties and the 3 school systems to identify what the goals are. And the most important goal that these superintendents said was that all children have to be reading at 3rd grade level by 3rd grade. If we don't have them reading at 3rd grade level, it is a school to prison pipeline. So these organizations have come together in order to make that happen, and the 4th one was the Metro Chamber.
Good.
So
thank you very much.
you.
Who's next? Who wants to go? Peter, I did see you first out of the corner of my eye.
Well, I applaud you on your peripheral vision. So this is an issue that I've been talking about the entire 18 months I've been running. In fact, the issue of education in Atlanta is one of the reasons why I'm running. I often say that I am willing to bet whether I have a second term or not as mayor on whether I have achieved measurable achievements in partnering with the Atlanta Public School System and improving youth development in the city of Atlanta. We cannot be a great city without great youth development. So what does that mean? First, yes, the relationship between the current mayor and the superintendent, I'll just quote what he said in a public forum, which was, I think he used the word terrible, was the word I believe he used. So that to me is unacceptable. I will partner with the superintendent. I've met with the superintendent several times, as many of us have. And so, yes, that's going to be happening. But we're going to work with the corporate and philanthropic community to get early childhood learning into place from birth to age 3, as well as many other initiatives to partner with the school system.
Keisha?
I wish that I'd had the luxury of only talking about the education issue in our city for the last 18 months. I have 4 children, and I am in a school cluster that is not at the top of our most successful clusters in this city. Nelson Mandela said education is the most powerful weapon which we can use to change the world, and that still remains true. With my 4 school-age children, they all learn very differently. And I'm very grateful to be able to have the resources to help them learn and thrive in the way that they learn. But really, it's about making sure that all of our children have those same resources. If we are not paying attention to what's happening to our city, we are not paying attention to what will happen to our future. I'm a graduate of Frederick Douglass High School, APS graduate, and I know what happens when you have a solid education and what's possible in this city. Like me, you can be the daughter of a single mother and you can go on to become a judge and you can run for mayor. There are plenty of opportunities available, but we've got to start with our education system.
Let's go right down the line with people who haven't had a chance to respond. John?
Once again, they have it wrong. The answer is the Harlem Children's Zone concept. President Obama adopted it and called it Promise Zones. They look at child development like a conveyor belt of development from 0 all the way to 22. 0 to 4, 5 to 8, 8 to 13. Every step along the way, there is a triage done with county, city, state, and federal resources to support the development of the child along the way. You've heard various answers up here. One thing that no one has ever talked about that is crucial is not 0 to 3, 0 to 4, it's the prenatal stage, when the mother is carrying the child. And this is where Grady Hospital can play a role in terms of proper education, and every child that's born in Grady Hospital should get some sort of package, the mother, in terms of how she can care for the child for the balance of his childhood.
Thank you.
I have to say I do agree with that piece, but you know, it's not as easy as it sounds. Every child deserves a great neighborhood school. I'm a former school board member, so I've seen the other side of the fence. Relationships really do matter in this, and there have been difficult and strained relationships on all sides when you think about the people on this platform as well as the mayor and the superintendent. So it's easy for people to say, oh yeah, we're just going to work it out, we're going to be partners. That doesn't always happen. So the reality is you have to work within the bounds of what you actually have in your hands. As mayor, there are a lot of things you can do outside of the school time where you can support families and children, as I've done in a place-based manner in the Yo Boulevard initiative. So that's really what it's like at Promise, or very similar to the Harlem Children's Zone. Those types of ideas are really going to be the place where the city can actually measure what it can do, and we've done that in the Old Fourth Ward. Thank you.
You know, if we don't work hard and partner together with respect to education, we're not going to be the great city that we want to be. I'm a product of the Atlanta public school system. I went to Benjamin E. Mays High School. My grandmother was a public school teacher right here in this city. My mother was an Atlanta public schools teacher. My wife right now is over at Inman Middle School where she teaches 6th grade language arts. There's no one on this panel that's done more work over the last 15 years in education than I. I've had for 12 years this program called the College Prep Series, which is a partnership with APS. So I'm not just talking about a partnership, I've been about a partnership with APS. These young folks who've come, almost 7,000 young people, have been able to get one step closer with their parents to go into college and to career. I was standing up when no one else was talking about making sure that we respected as a city APS with respect to the Beltline, and I provided leadership in getting that done. When I am mayor, there's going to be no space between APS and the city of Atlanta. We're going to have strong after-school programs in partnership with APS to get our young people ready for college and career, and I want every young person, I see your hand, Bill, I want every young person, when they graduate, to have the option of graduating with a high school diploma and an associate's degree so they can be ready for the future.
Thank you, Caesar.
Thank you.
Have you all, has everybody gone? I didn't think, no, let's go right now. Kathy?
Thanks for the question, Bill, and I hope you'll ask a further question of each of the candidates to make sure that we've all been attended Atlanta public schools as we grew up, and our children have. Everyone in my family has gone to public schools, and I'm a real supporter because my dad was in the Air Force, and we dropped in on schools throughout my life. And so it's important to me to think that any kid in Atlanta can go to any school in Atlanta and get a good education.
Well, let me ask you then, is there a candidate up here who you are uncomfortable, doesn't understand the public school system because they haven't participated themselves or their family has participated?
Well, I just think you should ask the question about who's committed to Atlanta public schools and have their children attend those schools, and did they attend public schools? Because I think it's an important distinction about people's experience growing up. What I will also say is when I got involved in this race 2 years ago, the first thing I did was call Maria Karstoff and said, I want to have a relationship with you. She said, what's the hurry? The election's a little while off. And I said, because we've got work to do together and I want to make sure we know each other. And that's about building healthy communities, for the mayor to build healthy communities around schools that are not being successful. You know, the Atlanta Beltline connects many of our schools in the city so that kids can walk to school and ride their bikes safely. And that's a new thing for the city of Atlanta. And to the extent that we can help kids begin developing healthy exercise habits, I think that's important. To the extent that we can create safe, affordable housing all over the city, including in neighborhoods where schools are failing, is an important contribution that we can make for the city of Atlanta. That our rec centers can add sports, literacy, and clubs, and that we expand our arts and culture programs so that every kid in Atlanta gets a chance to experience theater and arts and cultural activities.
Thanks, Kathy.
I answered the question, Bill, but I'd be happy
Oh,
to talk
you did?
some more.
I'm sorry. I apologize.
I'd be happy to take
apologize.
some extra time to talk, though.
Kathy, I take your point. I will certainly let people who are here attending today ask the candidates as they leave whether their families are part of APS or whether they're in private schools. And I think it's, I appreciate what you're asking.
Quick
But-
show of hands, which candidates attended public schools?
Well,
Atlanta Public Schools, President of
All right.
Mays High School.
Whose children?
Children went to Atlanta Public
all right,
Schools.
all right.
I think that matters, Bill.
Do you have children, Kathy?
I do not.
Okay.
But if I did, they'd go to public school.
All right.
Okay.
All right.
Want to talk about, it's a little hard for me to have children, but
The
you know.
point has been made. How many of you have attended or been in public schools? Doesn't matter if it's Atlanta or not, really.
First, this is a good question. It should be asked.
I think it's fair.
Yeah, let's
I
go
do too.
let's go
Let's
through
ask
and
it,
answer the
yeah.
question so that let's just go left to
just
right,
go
right
down
to
the
left
line.
and answer
Go
the
down the
question.
All
line.
right, Peter, real quick,
down the
go
line.
down the
Go.
line.
Yeah, so let's just go down the line.
Go ahead.
So I attended public schools. I was proud that my mom ultimately ran for and was on the board of the public school system that I attended. When I moved to this area and my wife and I had children, and it was time for us to pick schools, because of some unique learning differences of our kids, we did not choose to attend Atlanta Public Schools. But I am making education such a priority because everybody should have a right and an ability to attend as good a school as
Thanks.
possible.
I appreciate your illuminating us. I really do.
That's what I'm here for.
Keisha?
As I mentioned, I am a proud graduate of Frederick
Right.
Douglass High
Right,
School.
and you have 4.
I have 4 children.
Oh, my. And they're all in.
My children do not attend Atlanta Public Schools. As I mentioned, my school cluster is
Right.
not a successful school cluster, and I'm very grateful to be
Okay.
able to provide them with a fantastic education.
I get you, John.
No, it's a good question because there's a whole lot of hypocrisy
That's why we're
up
asking you.
here.
What's your-
really? I'm a proponent of public education. My children, my son graduated from Mays High School. My daughter's a senior at Mays High School. I'm a strong supporter of public education. I believe it, and I also have a PhD in education administration.
Keep Kwanzaa?
Yes. I went through Atlanta Public Schools, as well as my children went to Atlanta Public Schools or DeKalb County.
Caesar, I think you've already
Yeah,
said.
I'm a product of the public school system. My family is very invested in APS. I have 3 children. One is a 17-week-old boy, one is a 5-year-old preschooler, and my 6-year-old's in 1st grade in APS.
All right, Mary?
I grew up in Augusta, Georgia, so I did not attend the public schools in Atlanta. My stepdaughters.
Did you attend public school in Augusta
I did
or
not.
private school?
I attended a Roman Catholic school.
Oh, okay, okay.
Where the nuns really made you behave and learn. My stepdaughters, one attended North Atlanta, the other attended Westminster.
Okay, thank you.
I didn't grow up in Atlanta either. I grew up in Beaumont, Texas. My life actually started in an orphanage, at the Lutheran Social Services Orphanage. So I didn't have the good fortune of growing up in Atlanta. We had a governor that said if everybody could choose the circumstances of their birth, they'd be born rich, lucky, handsome, and with a trust fund. And so I didn't have that opportunity. But I did go to public schools my entire life, and I don't have any children. But I'm a strong proponent. I've helped hundreds and thousands of kids in our city get summer job
But
opportunities.
if you did, they'd go to APS.
Oh,
wouldn't
absolutely, absolutely. Because if I'm mayor, every APS
All right.
school will provide
Thank you,
opportunities.
thank you. Kathy, I hope we've, I think it was a fair question,
Thank
and
you.
I appreciate you bringing it up. Alexis, we're really running out of time.
Absolutely. So, what we're going to do now is begin our closing statements that you might want to have and hopefully make them relevant to health and the focus of the day.
Could I point something out as they start their statements? Because maybe they're even more important today than a week ago, because early voting began in Atlanta yesterday. So all the people here who are registered voters in Atlanta can hear the whole debate and then the closing statements and go right to the polls.
Or they can hang around and go to your next forum, which is later on today.
Well, I meant after this. I meant after this.
All right. Well, let's
Peter is
we'll
on.
start with Peter then.
Certainly. Thank you again all for attending. My name is Peter Amon, and I would like to earn your vote to be the 60th mayor of Atlanta. I'm the only candidate on the stage that has the unique combination of experience, having run the city of Atlanta, the experience of having worked in the private sector. I'm the only candidate on the stage that has the experience of holding people to the highest ethical standards in both the private sector and in the city of Atlanta when I was chief operating officer. I'm the only candidate on the stage that has the leadership, the demonstrated leadership, and a track record of bringing together the neighborhoods and the community with the nonprofit sector, with the government, and with the private sector to make things happen. Whether it was the founding of the Atlanta Police Foundation that created the At Promise Youth Center that was referenced, or working to help found and be the founding board chair of Partners for Home, an organization that helps coordinate the homeless services in the city of Atlanta, which I helped found. Again, thank you for your time. I'm Peter Amon.
Thank you, Peter. We've been asked by the authority to do this in alphabetical order as you were introduced, so understand there is a reason behind my calling next on John Eves.
Once again, I'm John Eves. Friends, this election is about leadership and integrity. Leadership, demonstrated results. You heard a lot of talk here tonight. I'm talking about demonstrated results. Number one, saved Grady Hospital in 2008, 2009 as a result of my leadership. Number two, did the most massive criminal justice reform in the history of Fulton County under my leadership, did 2 expungement summits, created the outsourcing of mental health in our community under my watch, reconfigured the health department under my watch, established a sex trafficking task force under my watch, created a HIV task force under my watch, did all of that in terms of change and having a positive impact on the health outcomes of citizens in the city of Atlanta. You need that type of person who is a demonstrated leader to be mayor of the city of Atlanta, but above all, not just the results, but integrity, which is lacking right now in City Hall.
Okay. The next person is Kwanzaa Hall.
Thank you. Relationships really do matter. So to do things in your own shop but not be able to connect with others is a travesty. And I've said this in many, many cases to people on the trail. Atlanta doesn't need a white mayor, a black mayor, a gay mayor, or a straight mayor. Atlanta needs a great mayor, a mayor who'll put people and neighborhoods first. We've been great at building buildings, but not so good at loving our people. And integral to that is the work that you all do. And that's the health-related things, preventing our citizens from not really having the outcomes in their lives as they deserve. I'm Kwanzaa Hall, and I'll be everybody's mayor. Thank you.
Thank you, Kwanzaa. Keisha Lance Bottoms, you're next.
Thank you. I've talked about my 4 children, and they are the 4 reasons that I am running for mayor: Lance, Langston, Lennox, and Lincoln. And I was a few minutes late this morning because Lennox was having an asthma attack. And I was very happy to have prednisone on hand and albuterol on hand. And that's the luxury that many of us have in this city. But so many of us don't have the resources and access to good health care. And so my reason for running for mayor really is about making sure that all of our children and all of our families have the access that they need to succeed and thrive. I believe that this city is full of opportunities and also challenges, but as mayor, I am committed to making sure that I bridge the gap between the two. I am a product and an example of what is possible in this city, and I hope that you will join me in leaving no community behind.
Thank you, Keisha. Cesar Mitchell.
Yes, this campaign and really the future of our city is about setting the right tone of leadership. And as mayor, I'm going to set the tone of leadership from the top. A tone of collaboration, the tone of working together with our partners, making sure that we are addressing the critical issues facing this city. My father passed away about 2 days before my 10th birthday from an illness that could have been prevented. So when I'm mayor, I'm going to make sure we're working with Fulton County. We're working with the hospital authority to address critical health issues in this city. I'm going to make sure we're addressing one of the most critical public health issues in this city, which is crime. I'm going to make sure that the intersection between crime and our young people is addressed, and we're going to make sure that our young people have every opportunity to succeed. Atlanta was a village when I was growing up, and that village is why I'm able to stand here and say I want to serve as your next mayor. Leadership starts at the top. And leadership is not just about saying you're standing out front, beating your chest, saying I'm the one. Leadership is about a spirit of service and a spirit of getting things done with others. I'm Cesar Mitchell, and I want to serve as your next mayor. Thank you for having me.
Thank you, Cesar. Mary Norwood.
Yes, I want to let you all know how essential Grady is to this city, this region, and this state. Your role is one of the most important we have. I have a husband who is a pediatrician in Atlanta for 40 years. His daughter is now a pediatrician at Piedmont. They both attended Emory University Medical School, and they both did their training at Grady. And it was an important factor for both of them to have that training at Grady because they know how much good work you do. When we have a health desert in our city and people can't get across town and people can't get to your facility and others, the mayor has to address that straight on. I will have a health czar who will be in my cabinet, who will be working with you and all other health providers to make sure that we are doing everything we can to keep our citizens healthy as well as safe. I'm Mary Norwood.
Thank you, Mary Norwood. Michael.
Yep. My name is Michael Sterling, and as I look around the room and see the reactions of everyone, I can almost sense the frustration. You've been looking at the same names on ballots over the same 8, 12, and 16 years, and folks have been making promises and telling you this time is going to be different. And what do we have in the city of Atlanta? We've got the worst income inequality in the country. We've got one of the worst rates of economic mobility. Last year, the city of Atlanta had a worse murder per capita rate than the city of Chicago, mostly due to gun violence. We've got an AIDS epidemic. And so folks get up here and they tell you about leadership matters and they tell you about different things, and you've been voting for them time and time again, and nothing has seemed to change. But this time can be different. This time we can do something new and something fresh. We can offer new leadership for a new direction for our city. This time we can end the political status quo and actually do something that's going to make a meaningful change in the city of Atlanta. We can vote for Michael Sterling. Early voting has started, and I'd appreciate your support. Thank you so much.
And we conclude with you, Kathy Willard.
Thanks so much. So I'm running because I'm fighting for ATL. If you take nothing away from this, remember, I'm working for affordability, transportation, and livability. Since the beginning of my career, I've been an advocate and working with many of you since the 80s, working on initial Ryan White funding, initial HOPWA programs in Washington, D.C., working here for Medicaid expansion, working here, leading the charge for needle exchange and HIV decriminalization. I've been the lobbyist for Planned Parenthood for over a decade. I know the issues that you care about, and so you don't have to come to City Hall to educate me on how I can be an advocate, because I know who you are and I know how I can help, and we can work together to change the city. I thought we could live in a different way in Atlanta by creating the Atlanta Beltline so people had safe routes to school, so that we could have clean air and have transit to get us there. I've worked on brownfields reclamation. The Atlanta Beltline was named the best environmental reclamation project in the world. We need clean water. As Keisha said, we've got some of the dirtiest air in the country and the highest rates of childhood asthma. We can change that. I want to use Invest Atlanta to end food deserts and make sure everyone lives near a grocery store with fresh food.
All right.
And we'll have a smoke-free city and a smoke-free airport. There's no accommodating smokers in Atlanta, Georgia when I'm mayor.
All right.
Wow. We have, it's Alexis, this has been said over and over again. This is a really good field of candidates.
Strong field of candidates.
Yeah.
And we want to thank all of you for being so faithful and dedicated to this task. And it's going to be a challenge for all of us to make a selection. So let's give everybody a round of applause. This concludes our program.
Yeah, I think
Thank you
someone.
very much.
Oh, yep, yeah. I guess we can let the candidates.
You want us to leave now, is that what you're
exit-
saying?
Get off the stage, please. Thank you. And I think you're going to hear about next steps right now, right?
For the-
Thank you, candidates.
Thank you again.